All right, I'm going to be reading a poem about ACE inhibitors and ARBs, or angiotensin II receptor blockers. First, I'm just going to do a brief explanation of the RAS system and how these meds play a role in the function of that system, which is the renin-angiotensin-aldosterone system, which works within our body to increase blood pressure. And these meds are going to do the opposite by blocking or inhibiting that process. So I have listed some things on this whiteboard to watch out for, indications, things to monitor for, and of course the illustration of the blood flow in the heart and the fact that these meds are going to decrease preload and afterload. So our poem, ACE inhibitors and ARBs. How are they different? Let us see. ACE blocks enzymes, so angiotensin 1 doesn't convert. ARBs block receptor sites, so angiotensin 2 doesn't work. ACE causes dry cough, possibly bronchospasms too, making ARBs more preferred for you. Just don't take them together, or low blood pressure, high potassium, and kidney problems are what will happen to you. Get a complete history. First thing to do. Make sure you know what meds they take, as some may interfere, like NSAIDs, will decrease effective ACE inhibitor, leaving one in despair. If on a diuretic, that may have to stop unless salt intake is increased, fluid volume can drop. BP will go down, the tubes causing heart to stop. Baseline vitals and weight to be taken, labs and EKG too. Level of consciousness to be assessed as well, since ACE inhibitors decrease circulation to the brain, causing dizziness. And both ACE inhibitors and ARBs metabolize in your liver and out the kidneys they go, creating dysfunction, affecting kidney functions, increasing bilirubin as well. Your diet is imbalanced, your potassium high. If your fluid volume drops, your BP can dive. You're at risk to fall, infection can rise, meds make white blood cells low. So your ability to fight infection goes. Skin integrity can change as meds run the game. Fluids excreted from effects of the med can decrease tissue perfusion, especially if you're lying in bed. My plan for you, let it be known, is that your blood vessels will narrow, then widen and relax. Dropping your blood pressure is where it's at. Risk of stroke will decrease, kidney functions improve, CHF will stabilize, things looking up for you. Make healthy choices, take meds as prescribed, so you don't invite trouble. Know what side effects to watch for, and call DOC on the double. Repeat what I taught you, understand all the facts, ask lots of questions, repeat all I've taught you back. Teach about medication, whether they be Divan or Cozar, well-known ARBs, perhaps ACE inhibitors like lisinopril or Vasotec. Too many meds to mention in one poem. Just make sure they know what they are taking, the reason they're on them, and the side effects that could come upon them. Teach to drink plenty of water, fluid volume at risk to go down. Avoid those bananas, avocados, and spinach. Gotta lower that blood potassium, not put more in it. Monitor for safe ambulation until response to meds is known. Otherwise, patient blood pressure may be out of the zone. Teach about side effects, dizziness, and headaches. No fun. Persistent coughing, annoying. and can cause extra fatigue, but most dangerous effects are tight throat and trouble to breathe. Seek immediate attention if you experience any of these. Heart's workload decreased. Your potassium leveled out. Positive responses to meds. Your blood pressure no longer shouts. You know the precautions to take, healthy decisions to make. No more hospital trips. Stay safe.